Twice a month, volunteers with the USF student-run organization Tampa Bay Street Medicine weave their way around the streets of downtown. You might not even notice them because the population they're treating often is not noticed.
10 Tampa Bay anchor Courtney Robinson shows you the real-life experience medical students gain through outreach to a community reluctant to reach out.
Are you feeling short of breath or winded at all?
This man doesn't just need wound care, he needs a hospital.
What we're doing is temporary, right?
And like others, these patients are not being treated in a clinical setting,
I'm gonna put this Band-Aid on here, okay?
but on the streets of downtown Tampa by USF med students.
There you go.
Hi, my name is Matt, and I'm a third-year medical student.
Loaded up with supplies, they're part of what we're taking you on right now.
Are we crossing right here?
Yes.
Okay.
A street run.
These are the patients who are really distrustful of the healthcare system and who typically wait until their medical conditions are so bad that it requires hospitalization before they seek care.
As we make our way toward Curtis Hickson Park,
Here are your socks.
smaller teams stop along the way.
You're not taking any of the medications, right?
You get you any socks or hygiene kits?
This kit's the icebreaker,
Q-tips,
and the interaction,
some hand warmers.
a chance to develop patient trust
And here's some wipes.
and learn how to get answers without a medical record.
Thank you very much.
Yeah, no problem.
Most of what I've learned about patient contact and interaction has been through the street runs.
You guys got everything you need?
As the group hits East Zack Street,
Yeah, I got some socks.
this is where things slow down.
You had a stroke.
These future doctors recognize some patients have serious conditions and call in the attending doctor to help diagnose, treat, and refer.
How long have you been off of your meds?
Remember this patient? His infected wound is the result of swollen legs that are likely caused by congestive heart failure.
You gotta get the swelling down.
He needs water pills prescribed by a doctor in the hospital.
The problem is if you leave it untreated and skin breaks down and gets infected, then that's where you're concerned that, hey, you could get a serious infection requiring IV antibiotics. You're trying to avoid all of that.
Sorry to interrupt.
No, you're good.
Can I have take a look at a patient?
Yeah, of course.
So it's this elderly woman who has these like pustules on the nape of her neck.
This patient has a skin issue
Does that hurt?
and also needs to go to the ER.
She may benefit just from a short course of antibiotics.
After their rounds on the streets of downtown, we circle back.
How many patients in all did you all help today?
So we helped about 22 patients today and had 2 referrals to the ED.
Providing health care that benefits all of us on and off the streets.
Well, you have a good day, okay?
Courtney Robinson reporting there. The street runs have their limits as students they cannot prescribe. They hope to expand that in the future to help people with conditions like diabetes or high blood pressure, as the goal to keep people healthy and out of the hospital.